I'm Dr. Jackson Smith, and I've dedicated my career to helping seniors just like you navigate the complexities of health and aging. Over the years, I've come to understand that our bodies have an incredible way of communicating with us. They send signals when something is wrong. Some of these signals are subtle whispers, easy to dismiss, while others are loud, urgent warnings that demand our immediate attention. But here's the truth. Certain warning signs should never be ignored, because when doctors see them, we know that something serious, even life-threatening, could be right around the corner. Have you ever experienced an unusual sensation in your body and wondered if it was something serious? Your body is always speaking to you, and sometimes those signs mean time is running out. In this video, we're going to uncover 6 critical warning signs that doctors recognize as potential red flags for serious health threats. These symptoms might seem minor at first, like a sudden wave of exhaustion that never fades, or an unexpected sharp pain in your chest, but they could be your body's way of crying out for help. Ignoring these signs could mean missing a vital opportunity to take action before it's too late. That's why it's crucial to understand what these symptoms mean and how they could impact your health. Stay with me until the end, because this information isn't just important, it could literally save your life. By recognizing these signals and acting fast, you have the power to take control of your well-being and possibly extend your years. Let's get started. 1. Unexplained extreme fatigue. A silent alarm you can't ignore. There's a world of difference between feeling tired after a busy day and experiencing an overwhelming, unexplained exhaustion that seems to take over your body. If you're feeling constantly drained, even after a full night's sleep, or if simple daily activities suddenly feel like climbing a mountain, your body might be trying to tell you something serious. This isn't the kind of fatigue you can shake off with a cup of coffee or a short nap. It lingers, it weighs you down, and, most importantly, it has no clear cause. Maybe you once enjoyed your daily walks, but now even a few steps leave you gasping for breath. Perhaps tasks as simple as cooking, getting dressed, or even holding a conversation feel like too much effort. This isn't just normal aging. It could be a sign that your body is struggling. Your heart might not be pumping efficiently. Your organs could be under stress, or your body may be shutting down essential functions to conserve energy. Doctors see this all the time in patients with conditions like heart disease, kidney failure, or even advanced cancer. When the body is using every ounce of energy just to keep functioning, fatigue becomes crushing. One of the biggest red flags, when this exhaustion comes out of nowhere or gradually worsens over time. If you used to have good energy but now feel persistently weak and drained for no obvious reason, it's time to pay attention. Your body isn't just tired, it's crying out for help. What you should do: take note of when this fatigue started, what makes it worse, and how much it's affecting your daily life. If your exhaustion is increasing and interfering with things you once enjoyed, don't dismiss it. See a doctor as soon as possible. The earlier you act, the better your chances of identifying the root cause and getting ahead of a potentially serious health issue before it's too late. 2. Sudden and severe chest pain or pressure. A life or death warning. There's one sensation you should never ignore: a crushing, squeezing, or intense pressure in your chest. If this strikes suddenly, especially if it radiates to your arm, neck, jaw, or back, you could be seconds away from a life-threatening medical emergency. Doctors warn that this type of chest pain is often a sign of an impending heart attack or an aortic dissection, one of the deadliest conditions in medicine. Unfortunately, many people dismiss it as heartburn, muscle strain, or anxiety, convincing themselves that it will pass. But when a doctor hears about this kind of pain, we don't take chances, because waiting too long could mean the difference between survival and tragedy. How to recognize the danger signs. Heart attacks don't always look like they do in the movies. The pain might not be dramatic. It could feel like mild discomfort, a dull ache, or pressure in the chest or upper body. Other warning signs include nausea, dizziness, shortness of breath, cold sweats, or unusual fatigue. Many people ignore these subtle symptoms until it's too late. If the pain feels sharp, tearing, or like something is ripping inside your chest, it could be an aortic dissection. This means the body's largest artery is tearing apart, a medical catastrophe that demands immediate emergency surgery. What should you do? Don't wait. Don't lie down and hope it passes. Don't assume it's just stress or indigestion. Call 911 or emergency services immediately. The sooner you receive medical attention, the greater your chances of survival. Your body doesn't send signals like this without reason. Chest pain is one of the clearest alarms your body can give. Ignore it at your own risk. If you're still watching and finding these insights valuable, comment number 2 below. Also, don't forget to subscribe and turn on notifications so you never miss out on life-saving health advice. Now let's move forward to the next warning sign. 3. Difficulty breathing or sudden shortness of breath, a silent but deadly warning sign. Imagine this. You're sitting comfortably in your chair, not exerting yourself in the slightest, when suddenly you feel it, a tightness in your chest, a struggle to draw in air. No matter how deeply you inhale, it's as if the oxygen around you has thinned, leaving you gasping and panicked. This isn't just an uncomfortable moment. It's your body sounding an alarm, and ignoring it could be a fatal mistake. Medical experts warn that unexplained shortness of breath is often a critical sign that something is dangerously wrong beneath the surface. It could indicate a serious cardiovascular issue, such as heart failure, a silent heart attack, or even a life-threatening blood clot in the lungs. Many people mistakenly assume that difficulty breathing is just a part of aging or a temporary inconvenience, but when breathlessness appears suddenly or worsens over time, it demands immediate attention. One of the most terrifying and often overlooked causes of sudden breathlessness is a pulmonary embolism, a deadly blood clot that lodges in the arteries of the lungs. The worst part? It can strike without warning. Perhaps you've been sitting for long periods, recently had surgery, or taken a long flight. Then, out of nowhere, a mild chest discomfort escalates into a suffocating sensation. The air feels heavy, your heart races, and panic sets in. In severe cases, this can lead to collapse or even sudden death if not treated immediately. Another possible cause is congestive heart failure, a condition where the heart struggles to pump effectively, causing fluid to accumulate in the lungs. This makes breathing increasingly difficult, especially when lying down. Some people even wake up in the middle of the night, gasping for air as their lungs struggle to function under the weight of excess fluid. And then there's the silent heart attack, a cardiac event that doesn't always announce itself with the dramatic chest pain we associate with heart attacks. Instead, it disguises itself as extreme shortness of breath, nausea, clammy skin, dizziness, and an overwhelming sense of exhaustion. Many people don't realize they've had a heart attack until it's too late, sometimes not until they experience a second, more severe one. So what should you do if you experience sudden shortness of breath for no apparent reason? Don't ignore it. Sit down, stay as calm as possible, and seek medical attention immediately. Whether it's a blood clot, a failing heart, or an undiagnosed lung condition, acting quickly could mean the difference between life and death. And now let's talk about another silent warning sign your body might be sending you, one that too many people overlook until it's too late. 4. Drastic and unexplained. Weight loss, when shedding pounds, becomes a silent alarm. Losing weight effortlessly might seem like a blessing at first, until you realize it could be your body's way of warning you that something is seriously wrong. If the pounds are melting away without any changes to your diet or exercise routine, it's not a sign of good fortune. It's a potential red flag that your body is battling something far more dangerous than you realize. Medical experts stress that rapid, unintentional weight loss, particularly in older adults, can be one of the earliest signs of an underlying disease. And in some cases, it's the only warning signal before a much bigger health crisis unfolds. One of the most alarming culprits: cancer. Certain cancers, especially those of the pancreas, lungs, and digestive system, can cause sudden and drastic weight loss long before other symptoms appear. This happens because cancer hijacks the body's metabolism, burning through calories at an accelerated rate. Your body begins to break down fat and muscle for energy, even if you're eating normally. But it's not just cancer. Drastic weight loss can also indicate severe metabolic disorders. Conditions like hyperthyroidism can send your metabolism into overdrive, leading to rapid weight loss. Undiagnosed diabetes. If your body isn't processing glucose properly, you could start shedding pounds unintentionally. Heart failure. When the heart struggles to pump blood effectively, it can cause the body to lose muscle mass and fat, leading to unintentional weight loss and frailty. The hidden cause: chronic inflammation and infection. There's another reason you might be losing weight that many people don't consider. Your immune system could be in overdrive, silently fighting off a major infection or chronic illness. Conditions like tuberculosis, HIV, or other chronic infections, autoimmune diseases like lupus or rheumatoid arthritis. These conditions can drain your body's energy reserves, leading to sudden, unexplained weight loss. Even long-term stress and anxiety disorders can alter your metabolism, making your body burn through more calories than usual. How do you know when to worry? Pay attention to these subtle warning signs. Your clothes feel looser, even though you haven't been dieting. Your belt needs to be tightened more frequently. People around you start noticing and commenting on how much thinner you look. You feel weaker, more fatigued, or unusually frail. What should you do? If you've lost more than 5% of your body weight within a short period of time without trying, don't ignore it. This is not normal aging. It's a signal that something inside your body isn't functioning properly. Schedule a full medical checkup. Get your blood work done. Insist on answers. The sooner you identify the root cause, the better your chances of catching something serious before it becomes life-threatening. Now let's move forward to another silent but deadly warning sign that many people overlook until it's too late. 5. Sudden confusion, disorientation, or personality changes. When your mind betrays you. There's something deeply unsettling about feeling like your own mind is slipping away. If you or someone you love suddenly starts forgetting things, getting confused easily, or acting in ways that seem completely out of character, don't ignore it. These changes might seem small at first, but they could be the first signs of something far more serious happening inside the brain. Why sudden mental decline is a major red flag. Doctors warn that when confusion, personality shifts, or cognitive impairment appear out of nowhere, it's often the result of a serious underlying medical condition. Some of the most alarming causes include stroke. A sudden loss of mental clarity, slurred speech, or trouble recognizing faces and places can signal a stroke in progress. Some people experience brief moments of disorientation that quickly pass, only to brush them off as exhaustion or stress. This could be a transient ischemic attack, TIA, also known as a mini-stroke. But here's the terrifying part. ATIA is often the first warning sign of a major, life-threatening stroke on the horizon. Brain infections, bacterial or viral infections such as meningitis or encephalitis, can cause rapid-onset confusion, agitation, or difficulty communicating. In older adults, even a severe urinary tract infection, UTI, can trigger delirium, leading to sudden personality shifts or erratic behavior. It might not be just old age. If someone seems confused, distant, or agitated, an undiagnosed infection could be attacking their brain. Alzheimer's and dementia. While cognitive decline is usually gradual, in some cases, neurological diseases like Alzheimer's or Lewy body dementia can cause a sharp and sudden downturn in memory, awareness, or personality. One day, a person might seem perfectly fine, then suddenly, they struggle to remember recent events or complete basic tasks, the deadly mistake people make. One of the biggest misconceptions about aging is that sudden confusion or forgetfulness is normal. It's not. The brain does not malfunction overnight without a reason. If someone who was previously sharp and independent suddenly seems lost, unresponsive, or unlike themselves, it's often because a medical emergency is unfolding right before your eyes. What should you do? Act immediately. If someone is showing signs of sudden mental decline, don't wait to see if it gets better. Call emergency services or get medical attention right away. Watch for stroke symptoms. If confusion is accompanied by slurred speech, facial drooping, or weakness on one side of the body, time is of the essence. Every second without treatment increases the risk of permanent brain damage. Rule out infections. If an elderly person experiences sudden disorientation, it might be due to an underlying infection, such as a urinary tract infection or pneumonia. A simple blood or urine test could reveal the cause. When it comes to brain health, every second counts. The sooner you seek medical attention, the better the chances of preventing permanent damage or even saving a life. Now let's move forward to another critical warning sign that too many people overlook. The final and most painful warning sign: severe and persistent abdominal pain. A mild stomachache is easy to dismiss, but when the pain is deep, sharp, or refuses to go away, it could be far more serious than simple indigestion. Doctors warn that severe abdominal pain, especially when sudden or long-lasting, can signal a medical emergency. Ignoring it could cost you your life. When abdominal pain becomes a silent killer, there are several life-threatening conditions that can manifest as severe stomach pain, and recognizing them early can be the difference between survival and tragedy. Ruptured abdominal aortic aneurysm, AAA. This is one of the most critical medical emergencies. The aorta, the body's largest artery, can develop a weak spot that balloons over time. If it bursts, it leads to massive internal bleeding that can become fatal within minutes. The pain is often described as a deep, unrelenting ache in the abdomen, lower back, or side, sometimes pulsing with every heartbeat. If you experience this, get emergency care immediately. Intestinal blockage or ischemia. When blood flow to the intestines is cut off due to a blood clot, twisted bowel, or advanced cancer, the result is excruciating pain. Your abdomen may feel swollen, hard, or extremely tender. If you haven't had normal bowel movements for a while, feel nauseous, or vomit, don't wait. This could be a life-threatening obstruction. Pancreatitis. Inflammation of the pancreas causes intense burning pain in the upper abdomen, often radiating to the back. It worsens after eating, making even small meals unbearable. Pancreatitis can lead to serious complications like organ failure if left untreated. If your pain persists and worsens after meals, seek medical help immediately. Gallbladder attack. Many people mistake gallbladder pain for acid reflux or gas, but sharp stabbing pain under the ribs, especially after fatty foods, could indicate a gallbladder blockage or infection. If the gallbladder becomes inflamed, it can lead to a life-threatening infection. When should you seek medical help? If you have severe, persistent abdominal pain that doesn't improve, don't try to wait it out. Seek emergency care immediately if your pain is accompanied by vomiting, fever, dizziness, or sudden weakness. Certain conditions, such as a ruptured aneurysm or intestinal blockage, require surgery to save your life. The longer you wait, the more dangerous the situation becomes. Final thoughts. Your body always warns you. Are you listening? If you've made it this far, you now understand that your body gives warning signs long before a crisis strikes. The key is recognizing what to look for and acting fast when something feels wrong. Ignoring these symptoms could be a fatal mistake. Acting quickly could save your life. From sudden chest pain and unexplained weight loss to shortness of breath, confusion, and severe abdominal pain, these are not signs to brush off. One of the greatest challenges as we age is accepting that our health can change in an instant. But here's the good news. Being informed gives you power. Knowing these warning signs means you can take control of your health, protect yourself, and take action when it matters most. Now I'd love to hear from you. Have you, or someone you know, ever experienced one of these warning signs? What did you do about it? Your story could help someone recognize a symptom before it's too late. Drop a comment below and let's raise awareness together. And if you found this information valuable, please share this with your loved ones. It could save a life. For more health insights, subscribe to our channel and turn on notifications so you never miss an important update. Your health matters. Stay informed. Stay safe. Thank you for watching. See you in the next video.